Jim from Elevation Health Medical, and today I want to share with you how your body works and how it gets dysfunctional or how it gets sick. So the first thing I want to go over is what most people do know, but maybe not realize 100%. The fact that the brain is what controls your whole body. And what most people don't realize sometimes is the brain does not communicate to the rest of your body through wireless signal per se. It uses a hardcore wire system called the nervous system. And the nervous system, if you look at this chart here, is what we call the spinal cord. So the spinal cord is directly connected with the brain, and it actually goes into your spine. So if you look at a model here of a spine, if you look at a bird's eye view, the brain sits right here in your cranium, and the spinal cord is what connects the brain with the rest of your body. And then from the spinal cord are these nerves coming out, and those nerves is what goes to the different organs in the body. So hopefully you guys can see a good pictures of that. But again, if you look at this chart again, we can see here with the representation of what the nerves are. These nerves in the neck go to the vital organs like your heart, your lungs, all the organs in your abdomen. And of course, these nerves in your neck also goes to your eyes, ears, nose, throat, and face. The nerves in the mid-back area are the ones also going to the vital organs in the rib cage area. And then the nerves in the lower back are the ones going to the lower organs in your body. We're talking intestines, reproductive organs, kidneys, bladder, and so on and so forth. So really, really important to know that, again, the spinal cord and the brains are connected together. The nerves go to every single organs in the body, and it's very imperative that you guys know that. Now, when we move to this other chart over here, now we can see the muscle system. And most people don't know this, but every single muscles are also controlled by those nerves. So for example, the nerves in your neck will go to all the muscles in the neck and upper back area. The nerves in the mid-back area will control these muscles in the upper back. And the nerves in the lower back area will control all these muscles here, including the ones in the legs. Again, very important to know because when we move an arm to, let's say, touch your nose, your brain sends power through the spinal cord to those nerves, flexing different muscles, relaxing other muscles to make that action happen. So again, nerves do that. Nerves control your muscles. Nerves controls your organs. And now you can see with this chart over here how the nerves are distributed in your body, controlling different parts. So for example, the nerves in the neck are the ones taking care of your shoulders, elbows, hands. The nerves in the upper neck area are the ones going up to the blood vessels of your brain, head and face again. And then the nerves in the mid-back area control the midsection area. The nerves in the lower back control everything, the lower back, abdomen, and also your legs like that. So that's how the nervous system operates in people's body. And the spine, again, is what protects all of those nerves, including your spinal cord. Now what I want to talk about real quick is if the spine and nervous system should look the way it does, how do we misalign those bones? Well, there are thousands of ways to do that, but I'm going to group them in categories here. Falls is one of the biggest way to misalign your spine. Every time you have a big fall, whether you fall on your head, on your shoulder, not only does it hurt when you do it, but what happens is there's misalignments happening in the spine here. So when you look at a normal nerve and how much room it has, that's normal, that's functional. When you have different trauma, what happens is these bones slightly shift out of alignment, and when they slightly shift out of alignment, they actually can put they never put direct pressure on the nerves, but the soft tissue around the nerves is what's going to put the pressure on the nerve itself, the nerve root itself, and that's what blocks the transmission of power from the brain to these different nerves going to the different parts of the body, and so on and so forth. So, and we're going to talk in the next video here about scoliosis and how those misalignments can create different problems that most of you guys are aware of. So that's how the nervous system functions.